So when we're thinking about what the best treatment approach is, we have some different options, and some of the things that we want to look at is what are the family resources and what other supports do they have, because if they do have a difficult time coping with something or there are competing stressors, where are they currently getting support from their environment? Do they have extended family? Do they have community supports? Do they have those kinds of things? Can we recommend those kinds of things for families as part of treatment? Maybe there's a support group. Maybe they can get, some other service from somewhere. Maybe we can hook them up with another family that's already in the system that can be a family mentor. There are other things that we could do that may relieve some of those stressors that then may make it more likely that we can push forward on some of the treatments. And we do want to do that when possible. So we do have to look at things like income, financial resources, where they're located, how far they have to travel to the clinic, or how long the service providers have to travel to get to them. We have to look at whether or not they have the ability to make a daily schedule. This benefit really is designed so that kids are in therapy every day, for the most part, or at least several times a week. And if that's the case, can they arrange transportation to get to a clinic 3 times a week? Are they even home during the day enough for somebody to come out and provide therapy to the child? Is it a safe environment? Those kinds of things. So we want to make sure that we assess that as we're deciding what kind of treatment we're going to prescribe for them. And sometimes we work on things like, what's your work schedule? Can you change your work schedule? Can you do something different? What support can you get from other therapies or other schools, or what kind of families and family members and other friends, those kinds of things. The main way that we can deliver services to children with autism is either by having a center-based or school-based program, or having something in the home that the parents are participating more frequently with. Those are kind of your basic areas. When you're talking about a parent-led program, what you're really talking about is something where the parents are heavily involved. They're doing a lot of the therapy. You're consulting with them minimally to kind of help them make treatment decisions and know what to do next for behavior. And then there are other more therapist-led kinds of programs where maybe you're doing stuff in the home and you're telling the parents what you're doing, you're telling the parents how to do it, but they're not as involved in the treatment decisions. And then we also have center-based kinds of things. And there are pros and cons to all of that. It is very beneficial for all of the kids to have somewhat of a multidisciplinary approach. Based on all of the problems that we were talking about earlier with all the medical conditions, the speech problems, other sensory needs and things like that, we really want to take a look at this kid from all angles to make sure that we're not trying to change a behavior that hasn't been dealt with in a more appropriate way. So it's nice to have all of those people really assessing the child. And it is a neurological disorder too, so it's very important. I haven't really talked about neurology much, but it's very important that the kids see a neurologist, because almost 25% of the kids have some other kind of neurological problem. They have seizures that are going undetected. They may have other kinds of brain abnormalities that need to be monitored, and there are sometimes medications that help with those things and that they should be on. Go ahead.
So in a situation like what you're talking about, like a behavior that arises out of like these undetected seizures, any type of like applied behavioral intervention probably wouldn't have much success.
Yeah, until you really treat the problem medically, right, you can't really break through some of the problems, because if the medical piece keeps getting in the way, then you're kind of running in circles. And sometimes you can make a little bit of progress, but you kind of keep hitting a plateau or something. And if you can get some help from the medical end, like even with the reflux or something like that, let's say you're running an eating program and you're doing okay behaviorally, but you just can't get past certain kinds of foods, well, maybe it's because there are problems with certain kinds of foods. So you really need to get it checked out. And I've had numerous occasions where we've sent a kid to neurology and they've come back with having some sort of a brain abnormality. And it's important to know what's going on, because you don't know what you don't know.
Right. Say, for example, like sometimes you get like, now still come out of nowhere.
Those probably aren't seizures, but I mean, you should get it checked out, but seizures aren't usually something that, a seizure isn't like a behavior.
Right, I think it's like something that hurts inside her head,
Oh,
and she reacts to it by tantruming real loudly.
yeah, well, that would be something that you would want to get checked out.
Right, but not only she punches the punching bag, so semi more appropriate.
So you have to change the behavior, but then you also have to know
Right.
more about the trigger, because if you didn't have the pain, then maybe you wouldn't have the behavior.
Sure.
So those kinds of things are important. As we're kind of looking at what's going to be the best approach, when you're talking about a parent-led approach and the parents are really the ones who are running things and making the decision, the consultant, their role really is to assess the child, write up some programs, and do some supervisory meetings. And then the parent really does everything else. They oversee the daily sessions, they're providing materials, they're implementing treatment in whatever the setting is. So this kind of parent that's going to respond well to this kind of a intervention is somebody who's pretty skilled. They're pretty organized. They don't have a lot of barriers to treatment. There's not a lot of other things going on. Sometimes when I interact with some of the different agencies, they reserve this kind of approach to the parents that are actually hardest to work with, because they've failed at every other approach, but they will fail at this approach too. If they don't show up to appointments on time, if they can't, finish their homework and those kinds of things, this doesn't make it a better approach for them. This actually makes it a worse approach for them. So those kinds of parents need more support rather than less. This is really the parent that you're going to give them a book, they're going to read it, and they're going to go to town, so they're going to take a lot of initiative, they're going to do a lot, they're going to jump right in there, and not only jump right in there, but jump right in there and do it right. And they don't need a ton of feedback. The number of hours often can't be obtained by the service providers themselves. This might be a reason why you would do something like this. Sometimes we would do this if the child lives in a remote area, or if you just can't get to them frequently enough. This might be a reason. And then all of the other pieces that I talked about that would make it more conducive to that on the parents' part, like their motivation levels and their ability to run all of this stuff. You also need to make sure that the parents have a pretty good solid support system. A program like this can be stressful, especially if they have all that responsibility and they have to do all those kinds of things. If they have a lot of other competing things going on in their life, they're going to have a hard time doing this, and they're going to get stressed out, they're going to get burnt out, and then they're going to drop. So you have to really think about all of that. They need to have the appropriate supports. So let's see what else. I think I talked about that. If you've got a child who also reacts emotionally to their child when they're distressed, or if the child has a lot of serious problem behaviors, they're going to have a harder time running this. Also, if the child is more severely impaired, they may have a harder time running this because the child's going to not necessarily respond to treatment as quickly or as easily as some other children. I think I covered everything for that. So then kind of moving on to some of the other models, having like a school-based or a center-based approach. This is really where the ABA programs are developed and implemented pretty much entirely by staff. And then it becomes more the parent's responsibility just to get them there, to show up to a couple of meetings to learn about the child's progress, and the clinician and the therapist really assume most of the responsibilities. This is going to be better if the parents really have a hard time with the skills and they lack motivation or training. Also, if the child doesn't have an adequate place to be in the home that is conducive to therapy, like if it's not really safe for them to be there, or if they don't have access to the right things, like for example, if you have a higher functioning kid that needs to have more interaction with peers and they need to be in a school setting, you would want to have them more in a center-based setting versus a home-based setting based on the child's needs, but also looking at some of those family pieces and really looking to make sure that that the environment is safe might be another consideration. It's going to be really difficult if the family lives far from the center. They're going to lose a lot of time commuting. Also, if the child has a lot of distractibility, this may be difficult depending on the environment because there might be a lot going on, particularly if you have one big room where lots of therapy is going on. You might have to put in a lot of things to focus on the distractibility pieces. The behavior could be a consideration as well. Sometimes it's better to have the child in a clinic-based setting because the more trained people are available to supervise more immediately, and sometimes it's not because sometimes the space isn't conducive to that, and you may have a child who has aggressive behaviors near other children with aggressive behaviors, and you might not be able to do that. So you really have to assess your own space and determine if this is right. Let's see, community-based approach. This is a little bit different in the sense that you're going to do the therapy out in the community where the person is supposed to be engaging in the correct behaviors. So for example, if the child has a hard time transitioning in the grocery store and the mom is really having a hard time taking that child out into the community to a restaurant, or she really would like the child to be able to participate in a preschool environment or something like that, then you would actually go to that environment and you would do the therapy. So again, usually the clinic staff are likely to do these kinds of things, and they're going to write all the treatment plans and they're going to help to implement this, but we're going to try to do it in the normative setting. So this is more of that natural environment training. The parents should still be attending meetings. They should always be informed of what's going on with the child and what the progress is. This is also recommended if you have kids that are receiving services in those areas, or if they're also in remote areas again, and you want to make sure that they can manage the environments that they need to go into on a regular basis and they're having a problem with that. It would be helpful to have more support from the parents to be able to run some of these things because of the generalization purposes. So you don't want to implement something in the community only with a therapist that won't generalize to the parents to be able to use it. So it might not be necessary to do this kind of an intervention if the parents are not heavily involved up front. So you might want to put this on hold until the parents can become more involved if you have a plan for that to happen. Sometimes funding that we're receiving for services does not permit us to go into the community. So you have to kind of assess what your funding source is and whether or not that's something that's going to be a reimbursable activity. And I don't know what the Medicaid benefit is going to cover as far as this is concerned and what the rules and regulations are, but I do know that the private insurance sometimes has issues where they will not reimburse for services in a school environment, or they may not pay for services that happen in certain environments, and we have to get special permission. So that's something that you might want to think about. It might be the most appropriate part of treatment, but there are sometimes other barriers or roadblocks that make that impossible. It can be very difficult to document what you're doing when you're going out in the community because you don't have all the things that you need or that you might have at the center. And it can also be difficult in running certain things because sometimes you can't do the same treatment in different places. An example of this is oftentimes we'll set up a treatment at the center and then we'll do a transition plan to send the children to school, and we'll bring our staff with them, and then the school policies will make it so that we can't run the behavior plan in the way that we develop the behavior plan at the center. So then we have to renegotiate plans in order to make it work in that environment. So that's a consideration that you have to think about as you're trying to set up some community-based treatments. Also, there can be a lot of scheduling conflicts with the child, and if you can't get it at the right time, at the right place, and the family really can't pull it together with scheduling, you may not be able to do this as well because you're kind of at the mercy of whoever's places that you're trying to schedule. So the place has to be open, their staff has to be available, those kinds of things. All right, so we are going to end a little bit early, but I want you to do one thing before you guys walk out the door, besides the other things that you have to do as part of this. I want you to take just a minute. I want you to maybe talk to the people at your group, particularly if they work at the same center that you do, and I want you to think about what you learned today. I want you to think about what your role is within the organization that you work for. and what some of the probable goals that you might be able to work on with the child that you've been assigned. I want you to also think a little bit about some of the barriers that you might encounter in treatment, what we discussed in this last module. And then I want you to also think about, with all of the things that you learned today, who in your organization can you go to ask questions about either these things or other things that you may now have questions on because you attended this. And the reason that I want you to do this, and this is very important, this is probably the most important thing that you'll do today, is because you guys are all gonna walk out the door and all of you are gonna be asked to do something that nobody at your organization knows how to do. So this is brand new to everybody, and you guys may be the only people that have attended this at your organization. So I really want you to think about what you learned today and how you're going to translate that back to the other people at your center so that we can think about how we can make this really work. I don't want you to do what most people do when they walk out of a training. I don't want you to take your folder and stick it in the car seat behind you and drive away and never look at it again. Okay? It's really important. I want you to do this piece because you're going to take it back and use it. Okay? All right. Thank you.